And as a clinical microbiologist, that means I'm a doctor who specialises in infections and bacteria and viruses, which is an incredibly fascinating area of medicine. And today I'm going to talk about pandemics and how they can begin and where we might expect the next one to come from. I'll use some examples to show you how new infections arise and how they can then cause an epidemic and a pandemic, and some of the things that we ought to be thinking about in order to prevent that. So, disease and illnesses have plagued humanity ever since the beginning, but it wasn't until the shift to agricultural communities and more people started living closer together, which is relatively recently in human history, that the scale and the spread of these diseases started to increase quite dramatically. People started trading, and all this new contact and travel created new opportunities for humans and animals to interact, and that spread up these types of epidemics. I really like this graphic here, which shows very clearly some of the most important pandemics that we know of in history. In the last century, the Spanish flu and HIV are among the pandemics that have killed the most people in history, as you can see from this graphic. And of course, we all remember right at the front there, at the bottom of your screen, the COVID-19 pandemic, which was caused by a coronavirus. The size of the pom-pom shows you how many deaths there have been as a result of each of these diseases. You can see that the Black Death or bubonic plague and smallpox have killed the most people to date. The Black Death actually killed up to half of Europe's population in the Middle Ages, and it took 200 years for Europe's population to recover from that. And as humans started living in bigger and bigger cities and with more and more exotic trade routes, again, they had more contact with different populations of people, and so it became more likely that pandemics would occur. And one important lesson here is that the thing that many of those infections that you saw in the last slide have in common, apart from smallpox, is that they originate from animals. Infections that can infect both humans and animals are called zoonotic infections. And it's estimated that around 70% of new infections come from wild animals. It's also estimated that there are around 1.6 million viruses out there in animals. About half of them might be able to infect humans, and most of them we know absolutely nothing about. So the greatest danger of a pandemic stems from viruses in other species, and the recent history of infectious diseases is full of examples of this. So we're going to take a look at some obvious examples now. The examples that I'm going to talk about this afternoon are the coronavirus, HIV, the Ebola virus, and Nipah virus, which is a disease that's less well known, but is a really excellent example of what I want to discuss. So let's start with the coronavirus family of viruses, which I'm sure you've all heard a lot about during COVID. The coronavirus is the family of viruses that contain SARS-CoV-2, which caused COVID-19. And this is an image taken by an electron microscope of some coronaviruses. Remember that viruses are so tiny that we can't see them under an ordinary microscope or a light microscope. We need an electron microscope. And you can see the spikes around the outside of the virus, which are said to look like a crown, which is why these are called coronaviruses. And this virus family had been, until recently, somewhat ignored by doctors, and a lot of what we knew about them before COVID came from the work of the veterinary community, because these viruses are very common in animals. Now, there are 7 types of coronavirus that infect humans. The ones at the top of the list in orange cause the common cold. They are responsible for about 20% of common colds that circulate. Sometimes in young children and in the elderly, they can lead to pneumonia, but that's unusual. And then we have the 3 coronaviruses that we know that cause more severe infections, which are the original SARS-CoV virus, MERS-CoV virus, and SARS-CoV-2, which was the cause of COVID-19. I'll just talk a little bit about what they all are. Now, these 3 more serious coronaviruses, one thing that they all have in common is that they originated in bats. In fact, scientists think that bats carry over 3,000 different types of coronavirus. And what's always happened is that these have jumped the species barrier from a bat to another animal before making a jump to humans. Now, the first SARS-CoV virus, the one on the left here, first appeared in China in 2002, and it was transmitted from bats into a rather cute little creature that you can see here called the palm civet. And this virus was very similar to SARS-CoV-2, but didn't spread as easily as COVID-19 did. So at that time in 2002, around 8,000 people were infected, but after a huge effort to stop it from spreading, it was contained and it disappeared. It is possible that the original SARS-CoV virus may be still circulating in animals. We can't be absolutely sure that it might not reappear sometime in the future. Then we have MERS, which stands for Middle East Respiratory Syndrome. And that first appeared in 2012 in the Arabian Peninsula in the Middle East. And this is a really serious infection that kills about 1/3 of people who become infected. But luckily, it's relatively difficult for it to be transmitted. And most people who catch it are either in close contact with camels, which are the natural reservoir who've acquired it from the bat, or otherwise they are health workers caring for cases usually. And this infection is still around. We have to look out for it when people come to hospital with fever after travelling to the Middle East. And then thirdly, of course, we've got SARS-CoV-2, the cause of COVID-19. In fact, even now, scientists are uncertain what animal this was transmitted to before humans or how exactly it ended up in humans. And this is something that, unfortunately, we may never know now. But if SARS and MERS coronaviruses weren't enough of a warning of the danger of new infections in the 21st century, another one was the epidemic of Ebola in West Africa in 2014. Now, you're probably too young to really be able to remember that. I remember it very well. This is the Ebola virus under the electron microscope. You can see that it looks completely different from the coronaviruses. And Ebola is an infection that also lives in animals in remote forests in West and Central Africa. Scientists now believe that fruit bats may be the natural home of this virus, but it can infect a number of other animals, and the natural reservoirs aren't completely understood still. There's been various smallish outbreaks over the last decades, but the 2014 epidemic gave doctors and scientists a real shock. Now, this is a map, obviously, of the African continent, and within the red circle in West Africa, on the left of the image, you can see a red circle. That's where this epidemic happened, in the countries of Guinea, which is the pale green country there, Liberia and Sierra Leone. Now, this outbreak started in a village in Guinea called Meliandou. And what had happened was that the forests in this area had been cleared for the cultivation of oil palms. And this meant that the bats, which used to live in the forest, now had nowhere to live. And so they came to live in the village in various nooks and crannies and under the eaves of the houses in the village. And they actually also became an important source of food there. So one afternoon, towards the end of 2013, the children in the village were playing around an old tree stump. Here it is in this photograph. And in the tree stump, there were some of these bats. And the children were amusing themselves, poking these bats and getting them to fly out of the tree stump, and actually then cooking and eating some of them on a small fire. This is the kind of bat that we're talking about in this case. Now, soon after that, One of the children, who was a 2-year-old boy, became ill with a fever. Everyone thought he had malaria because that was common in the area. But sadly, after a few days, this little boy passed away, and then so did his mother and sister. A nurse was called in, but unfortunately, she wasn't able to help very much. Now, if Meliandu village was a village that was very deep and remote in the forest, that there wasn't much coming and going from, that might have been the end of the story. But as it happens, this village was only about 6 miles from the town of Gwekadu, which is a busy shopping centre close to the border with Liberia and Sierra Leone. And from there, there's a huge main road that connects to Conakry in Guinea, which is the capital city. The first person outside of the little boy's family to get sick was the nurse who had looked after his mother. She was taken to hospital in Gwekadu, and sadly she also died there. And during that time that she was in the hospital, other health carers got infected as well. And within a few weeks, before anyone had really realised what was happening, there was an epidemic of Ebola spreading across the borders of Liberia and Sierra Leone as well. And the 2014 epidemic was the largest ever Ebola epidemic, with almost 30,000 cases. There was a huge international effort to get it under control. Healthcare workers went there from countries all over the world, including from Wales, to help out. But what had happened was that the activity of cutting down these forests had disrupted the creatures living there that were carrying these viruses, and humans came into contact with them because they'd come into the village as a result. And on top of that, the ill patients were all crowding into clinics and healthcare facilities that didn't have adequate resources to be able to control the infection, and gave it the opportunity to spread easily and to reach large towns and cities. Another good example is HIV, which I'm sure you've all heard about, human immunodeficiency virus, which caused the last truly devastating pandemic at the end of the 20th century. And scientists believe that this also was derived from animals around the 1920s. At the turn of the 20th century, the arrival of steamships on the Congo River made it possible to travel deep into the tropical African forest and build railways and roads there, and workers came to make big money cutting down trees and logging to get timber. And this photo from that period shows you a ship carrying cargo in the area of Africa that was then known as the Belgian Congo. And so camps of workers came to live where this logging activity was going on. They lived in the forest in these camps, and they had a trade in bushmeat. So workers were eating wild animals from the forest. And it's believed that this is how HIV found its way out of the forest animals into human populations. And it was then endemic. That means it was present at some level in Africa between the 1920s and the 1980s, when it finally emerged in the West as the beginning of a huge pandemic. So the rush to make money by destroying the forest was really responsible for the spread of HIV as much as the virus itself. Another really good example of a new virus that's currently emerging is the Nipah virus. I appreciate you probably haven't heard of this, but it's a really good example. It was first discovered in pig farmers in Malaysia in 1998. And Nipah's natural home is a type of fruit bat like these. These are very, very common across Asia. In 1997, around 10 million acres of tropical forests in Southeast Asia were set on fire to make room for cattle and palm oil plantations, especially in Sumatra and Borneo, that you can see on this map here. And as a result, all the huge population of fruit bats that lived there had to leave the burning forests, and some of them came to live close to these huge pig farms near a village in Malaysia where that green ring is, called Sungai Nipah, after which the virus is named. So you see, we have a recurring theme here, similar to the story with Ebola. And near to this huge pig farm, there were mango trees growing close to the pig yards. And the bats were feeding on the mangoes, and their droppings were falling on the mangoes as well. And then the mangoes, which had been soiled, were falling into the yards where the pigs were, and the pigs were eating them. The pigs got infected with this new virus, developed a lung infection, and then the pigs were coughing onto the people who were farming, and then the farmers, unfortunately also became infected. And during this epidemic, which was the first time that this virus had ever been identified, it was completely new to science, over 100 people died, and millions of pigs had to be culled all across Malaysia to prevent the outbreak from spreading any further. And since then, Nipah has appeared again almost annually in Bangladesh and eastern India. Although in these countries, it's not associated with pigs so much, but with the consumption of fruit, especially drinking date juice, which is a very popular drink there. Nipah appears there in those regions between November and April, usually every year. It's seasonal, which is the season for dates. And what's happening again here is that the expansion of villages and farms has made it easier for these animals to come into contact with people's food. They like to live close to the villages and people's homes where fruit is easy to find, and they contaminate the date palms before people eat them. Unfortunately, these Nipah-carrying types of bats are very, very common and are found in lots of Asian countries and also in parts of Africa like Madagascar, which you can see on this map, and even also in Australia. And some of these areas, of course, are very populated and are areas where there are a lot of farm animals. So there's lots of potential for it to spread to people. The blue diamonds on the map shows you where Nipah outbreaks have happened up until now. So that's a handful of examples of viruses jumping from animals to human, but there are many, many more examples, and these are called spillover events. Spillovers actually happen fairly often, but usually the infection doesn't spread very far and no one really knows about it outside of the area where it happens, which is often a rural area. A pandemic can only happen when the circumstances are just right. And the root cause of about 30% of these spillover events is probably change in land use. The evidence shows that viruses are more likely to transfer to humans or animals if they live near human-disturbed ecosystems, like recently cleared forests or swamps drained for farmland or mining projects or residential projects. And all of this, of course, is driven by trade and consumer behaviour. A quarter of global forest loss is driven by production of products like beef, soy, palm oil, and mining adds to the problem by contaminating rivers and streams that we need for a healthy ecosystem and for carbon capture and soil quality. So there's a strong argument that these social and economic and environmental factors are at the root of this problem, whilst we tend to fall into the trap of focusing on the individual pathogens that cause these diseases, as I've done a little bit in showing you those examples. Really, if we focus too much on the individual pathogens every time, we get a very narrow and incomplete understanding of the problem, which prevents us from seeing the bigger picture. This diagram comes from a study that looked at the factors that are likely to lead to the risk of the emergence of a new infection. It shows you that the biggest risks are in areas of tropical forests, which are evergreen broadleaf trees, and where there's the presence of wildlife and people. The more to the right the boxes are, the higher up in the table, the higher the more that risk factor is implicated. And actually, even planting trees can increase the risk to human health if it's limited to too small a number of species, which is often the case in commercial forests. And that's because these infections are prevented and filtered by a wide range of habitats and animals that you find in a healthy forest. If you replace that with, say, a soy plantation, you lose a lot of the specialized species and you get more general predators like rats and mosquitoes flourishing, and they can spread infections between the different habitats. So you get a loss of the natural processes that control organisms from spreading. And this map shows you the areas of the world where these spillovers are thought to be most likely to occur. So that's the yellow areas on this map. There are high-risk areas on every continent. They tend to cluster either in tropical areas or where there are very dense populations. So as the natural habitats shrink, wild animals get concentrated in ever smaller territories and get pushed closer to where the humans are. I'm now going to show you a completely separate map. This is a map of North Wales, as you can see, and it shows all the places that my great-grandmother travelled in her life. She came from Betws-Gwerfyl-Goch near Corwen, and I don't think she travelled in her entire life further than Liverpool. This map shows you where my grandmother went, because she went on a holiday to Europe a couple of times in her lifetime. And this map shows you where I've travelled. So within 100 years, the patterns of movement of people around the world have been completely transformed. Of course, bacteria and viruses don't respect international borders, and in a world where international travel is so easy and common, infections can spread across the globe in hours. So through destroying habitats and then travelling excessively around the world, we're not only accelerating global warming and wreaking environmental havoc, but we're also increasing the risk of emerging infections, which then have a chance to spread in under-resourced healthcare facilities like this one. So all of these problems are interrelated and they all stem from the same kinds of human behaviour. So we really need to learn to look after our environment and our planet better and give all the creatures in it room to thrive. And this has led to the idea of One Health. So One Health is the concept that animal health, human health and the environment are all really closely interlinked and interdependent. We can't address these complex problems. They're sometimes referred to as wicked problems because they're so complex. We can't address these problems only by focusing on human health and medicine. We have to take all the rest into account together and work in all of these sectors together. At the top of the list of the main challenges at the moment for humanity, as we know, are climate change, antibiotic resistance, pandemics. People have started to realise that the destruction of habitats risks making many species of animals extinct and could contribute to climate change, but not so many realise that it's also dangerous due to the threat of infections and pandemic diseases. So all of these problems are related, as I say, and they all originate from the same types of human behaviour. So what lessons can we take from this? Well, there are really three categories. First of all, the ecological, which we've talked about, the changing ways that we use land and destroy habitats. Secondly, the social considerations like people's travel patterns, the way farms are run and becoming more intensive, and healthcare facilities and the way sick patients are put together in healthcare facilities that aren't always able to control infections as they should. And thirdly, political lessons. We need strong public health systems all over the world, and we need to remember that pandemics actually hit the poor and disadvantaged populations the worst. And weaknesses in all three of these areas have made it easier and easier for infectious diseases to spread, and we need international solutions. We need to address these other problems if we're going to take infectious diseases seriously. So what does that mean for you and your studies? Well, what it means is that whether you decide to study and work in human healthcare, medicine, or biology and animal health, or ocean sciences, or environmental studies like forestry, or politics and policy and law, you can all contribute to solving these problems, because One Health means they're all interconnected and they're all equally important. So that's it from me. Thanks for listening. I'm happy to try and answer any questions that you may have, if you have any. Thank you very much. Diolch yn fawr am wrando.
Diolch yn fawr iawn. Thank you very much, Angharad. A very comprehensive, really interesting presentation there from you. I'm sure that people listening have learned an awful lot about it, and I'll give you now some time to think about questions, but we do have one that's come up already, Angharad, saying, sorry if this is a silly question, just to reassure you, there's no such thing as a silly question at all.
Definitely not.
Definitely not. Yeah, thanks, Angharad. But what is the difference between an epidemic and a pandemic?
So pandemic, it sort of generally means that the epidemic has spread to affect the whole world or most of the world. Pandemic does, so pan means everywhere. So it means it's gone everywhere. There is actually a formal definition that the World Health Organization uses for a pandemic that has certain criteria. And there was a lot of argument at the beginning of the COVID-19 pandemic. They didn't want to call it a pandemic, even when it was obvious that it really effectively was a pandemic, because it didn't exactly meet all of the criteria in their very strict definition. So for a long time, they were calling it a public health emergency of international concern, which isn't quite as catchy as pandemic, but it did eventually meet the criteria for a pandemic. But really, pan means everywhere.
Great, diolch yn fawr iawn. Thank you, Angharad. I've had another question in. Again, if anybody wants to add just comments rather than questions to add to the discussion, again, please do. There's no such thing as a question that we're not happy to answer. But the comment says, fascinating lecture. Thank you. Definitely agree with that. Asking this is a bit more challenging, I think, Angharad. Which One Health concept do you think would have the biggest impact to tackling pandemics, and if any, really?
That is a great question. And I think probably it is it's difficult to pinpoint one most important thing, because, as I've said, all of those things within One Health, the environment, animal health, human health, they're all interlinked and they're all important. But I think if there's one thing that we can learn from all of that, it's that we should stop interfering in animal habitats, and we should leave wild areas alone for animals to be able to have room to live in them without having to be pushed closer and closer to human populations all the time, because that is always going to be a risk. So I think it would be about the environmental, the habitat destruction. And of course, that's important for climate change as well. And climate change then also links into infectious diseases as well, because now that we have a warming climate, there's lots of tropical infections, or things that we think of as tropical infections, are spreading into other areas of the world because they're getting warmer. So, for example, if you've heard of dengue fever, dengue is a viral infection as well that's spread by mosquitoes, certain types of mosquitoes. We used to think of dengue as being a tropical exotic infection, but it is now being seen in Spain and even in France. So climate change, which deforestation is contributing to, is in turn having the effect of increasing the spread of infections to new parts of the world.
I was going to say, Angharad, do you think there's definitely a case for environmentalists and medics working more closely together on a lot of these things?
Absolutely, and that's what the One Health agenda is trying to encourage, a lot more of intersector working between all of these different disciplines, because one discipline can't solve it all on its own. So medicine is focused on the pathogen and treating the patient, but that is not going to solve that. That's a bit of help. That's a help for that patient, but it's not going to prevent new pandemics arising. So everybody definitely needs to work together.
So for everybody listening and joining us this afternoon, what we want is a collaborative approach. It doesn't matter what the interests of the people joining us today. If anybody wants to go into the profession, it's all about working together and sharing knowledge.
Absolutely. And so many fields that you may want to study, you don't have to study medicine, for example, to have an impact in this area. All of those different disciplines can be impactful and important. So please do think about that when you're thinking about what you want to study, because they all can contribute to solving this problem.
We've got another question as well from somebody who's joined us. Thank you very much. So again, thank you for the lovely talk. I concur. What would you say the effect of antibiotic antimicrobial resistance will be on the possible future of pandemics and epidemics, and whether it could trigger more pandemics or epidemics in the future?
Well, some people refer to the spread of antimicrobial resistance as a slow pandemic in itself. So it has been called the slow pandemic because antimicrobial resistance is already spreading across the world, except we don't really notice it. It doesn't hit the headlines in the way that COVID-19 did, but it's there, and it's going to have a huge impact on human health in the next, well, from now until for the rest of this century, really. It's already impacting on human health. So that in itself is a type of pandemic. So, yeah, I'm not sure if that actually answers the whole question. I've forgotten what the exact question around that was. So let me have a look.
Just saying that with the resistance, could it maybe trigger more in the future was the main part of the question.
Yeah, well, so as I said, that actually is a type of pandemic itself. And the problem with antimicrobial resistance, of course, it makes infections harder to treat. And if they're harder to treat, that means they're harder to control from spreading as well, because the way that we prevent infections from spreading between humans is by treating the infection in the case so that they can't spread it to other people. So yes, it does make it easier for infection to spread as well.
Now, if anybody's got any final questions, please add them now. I've just got one of my own I'm going to throw in, Angharad. We were talking about, the different types of effects it can have on people, how we all need to work together, and politics is something that you mentioned as well. Can you give us or share with us an example of a good policy that you've come across that helps tackle some of these issues?
Yes, well, there are plenty. So, for example, the UK now has got an antimicrobial resistance national action plan, which is a 5-year plan, which we're putting into action at the moment. That is packed full of different types of policies, but including One Health considerations and including environmental considerations. Of course, that is for the UK. But there is a World Health Organization action plan as well. And there is, we have Professor Sally Davies, who's an ex-CMO for the UK. She is the UK's envoy to the United Nations on antimicrobial resistance, and her group in the UN has been making lots of policies around this, which are really interesting.
Great, so that sounds very positive for the future, Angharad.
Yes, definitely. There's lots to do, but we know what to do, and so we're relying on all of you in the future to come and help with all these efforts.
Brilliant. Well, I think we haven't got any other questions coming in at the moment, but thank you all of you for sharing the questions with us, and thank you again to Angharad for giving that excellent talk. So we hope you enjoyed today's session, and if you are interested in medicine or, like we said, other topics from the North Wales Medical School courses, please take a look at our web pages and you can find out more information on there. And we've also got details of our open days. We've got 2 coming up this summer. We've just got another question coming in as I'm about to wrap up, Angharad. So we're here to answer the question. So let's make sure that we do that. So this question is asking, what factors do you think resulted in COVID-19 having such a global impact in comparison to other recent pandemics? So nice heavy one to end on.
Yeah, so I actually nearly put a slide in on this, but I didn't. But one of the problems with COVID-19 was that it was really quite infectious. So it was very easy to transmit, and in particular, it was easy to transmit before symptoms started. So that was one of the things that made it really difficult to control. And that combined with huge increase nowadays in travel around the globe meant that it was able to spread to all parts of the world really, really quickly before anyone had even realized that there was going to be a pandemic. That it had already, by the time they realized in China what a problem they had on their hands, the horse had already bolted, and it was too late to stop it from reaching everywhere in the world, really. So that was to do with how transmissible it was, and how it was transmissible before people really had symptoms.
And then we've got another question that's come in a bit more about future and what we could do about it. So again, thank you for the brilliant talk. Do you think AI might make future pandemics more difficult to control or easier, given that AI is harmful to the environment but might be useful in battling the issues?
Well, that's very interesting to think about. I suppose AI can help us especially in areas like surveillance. So one thing I didn't talk about in this lecture is the importance of surveillance, and what that means is actively going out tracking what's happening with these infections, and keeping tabs on them, and collecting data on different infections going on in different places, and flagging up when there are little spikes. And I think AI could be very helpful with that, and in flagging up when there are abnormal patterns or new patterns of transmission popping up. AI would be good at spotting that kind of change. So I think it could be useful when applied to surveillance data, which needs to be collected across the world. And it's something, so surveillance is really, really important and critical. Some parts of the world have less surveillance going on than others, and it's something that needs to be developed, and I'm sure AI could help.
I think that's a very topical question to end on there. So again, thank you very much, everybody, for joining. I think we're done on the questions, but I'm still keeping an eye on it.